Do you suffer from coronary atherosclerosis or angina and are about to undergo therapeutic catheterization? Here's everything you need to know on your journey to recovery, may it never be necessary. What are coronary arteries? They are the blood vessels that supply the heart muscle with oxygenated blood and the energy needed for normal functioning. They consist of two main arteries, the left and right, along with their branches, each responsible for supplying a specific part of the heart muscle. How does coronary artery disease develop? Fatty material builds up in the walls of the arteries feeding the heart muscle, forming fatty deposits. These deposits can rupture due to heavy smoking, stress, or consuming a large meal, causing their contents to be released into the artery. This leads to thrombosis, which can result in total blockage and restrict adequate blood flow to parts of the heart muscle. This condition is called angina or a heart attack. Factors that increase the risk of artery blockage include hypertension, diabetes, smoking, stress, obesity, genetic factors, and high levels of blood fats. What are the common symptoms experienced by the patient? It starts with severe pain in the center of the chest, described as a pressing, squeezing, or heavy weight on the chest. The pain may spread to one of the shoulders, neck, lower jaw, abdomen, or back. It may also be accompanied by shortness of breath, nausea, sweating, fatigue, and generalized weakness. If you experience these symptoms and the pain lasts for 15 to 30 minutes, call 997 immediately to be transported to the nearest hospital. Upon arrival at the hospital, your vital signs, electrocardiogram, ECG, and heart enzyme tests will be taken. If you are diagnosed with a coronary artery blockage, myocardial infarction, antiplatelet and anticoagulant drugs will be administered. The cardiac catheter lab will be prepared for your procedure. Cath lab, cardiac catheter lab. In high-risk cases requiring immediate intervention, the patient is transferred directly to the cath lab for urgent catheterization. In other cases, the patient is admitted to the Cardiac Critical Care Unit, CCU, and the procedure is scheduled within 24 to 48 hours, based on the patient's condition. Pre-catheterization instructions. No food or drink for 4 to 6 hours before the procedure. Inform the medical team about any drug or food allergies. The catheter insertion site, wrist or groin, should be shaved. Remove all jewelry and metal accessories. In the catheterization lab, the doctor and medical team prepare the patient for the procedure. Procedure preparation. Sedative medications and local anesthesia may be administered at the site of the peripheral artery, wrist or thigh, to relieve tension and pain. Catheter insertion. The catheter is then passed through the peripheral artery to the coronary arteries, while the patient is asked to take a deep breath and hold it in their lungs to facilitate the catheter's access to the heart. Diagnostic examination. This examination relies on using contrast dye and X-ray imaging to determine the locations of any blockages or narrowing. Internal imaging. A contrast dye is injected to obtain clear anatomical images of the coronary arteries. During this process, the patient may feel warmth in the chest, a change in taste, or mild headaches. Therapeutic intervention. If treatable narrowing is detected, a balloon or drug-coated metal stent is immediately used to open the arteries and restore blood flow. When the balloon is inflated, the patient may feel chest pain, which is temporary and will subside once the air is released from the balloon. Stent. A drug-coated metal mesh that remains permanently in the body. If there is significant or multiple narrowing, the artery responsible for the infarction is first opened using a drug-coated balloon. Cardiac surgeons will be consulted if surgery is needed in a separate session. There is less than a 1% probability of complications, which may include allergic reaction, heart rhythm disorders, infection and inflammation, low blood pressure, bleeding, skin sensitivity, kidney failure, blood clots in the brain or heart. Recurrent infarction or artery blockage. Artery rupture requiring emergency surgery. Finally, remember, cardiac catheterization is generally safe. The death rate is only 0.05%, equivalent to 5 cases per 10,000. Intensive cardiac care. After completing the therapeutic catheterization procedure, the patient is transferred to the intensive cardiac care unit to monitor their condition and ensure stability. Post-catheterization care. The catheter needle is removed from the peripheral artery insertion site, either wrist or thigh, in the cath lab, and a small pressure device is placed to prevent bleeding for 2 to 6 hours. Handling the catheter insertion site, the patient may notice a change in color, or slight redness or swelling, at the catheter insertion site. This is normal and should disappear within a few days. Positioning instructions. When the radial artery, wrist, is used, keep your hand straight and avoid bending it for an hour. When the femoral artery, groin, is used, lie on your back with your leg extended straight for 6 hours. Avoid raising your head more than 30 degrees until the medical team permits it. Close monitoring. The medical team will monitor vital signs, blood pressure, heart rate, breathing, and regularly examine the catheter insertion site for signs of bleeding or complications. Immediately inform the medical staff if any of the following symptoms occur: bleeding at the catheter site or feeling moisture. Numbness in the fingers. Heat or pain at the insertion site or in the chest. You will need to stay in the hospital for 1 or 2 days. After confirming the stability of your health, it will be time for your discharge to begin the recovery phase and safely return to your normal life. To ensure the best possible outcome and prevent any complications, follow your doctor's guidelines, continue taking medication for a full year and do not stop any medication without consulting your cardiologist. Manage blood sugar and blood pressure. Avoid smoking. Walk for 30 minutes daily. Follow a healthy diet. Dear patients, we kindly ask you to follow these instructions carefully for a smooth recovery. Do you have any questions? Feel free to contact us. With gratitude to our partners in success, Calby Association, Community Partnership Department, Executive Patient Experience Management, Heart Health Center, King Saud Medical City, Walida Badr bin Saleh Al Rajhi and Sons Charitable Foundation.